Now that a community demographic profile and health profile have been completed for Trenton, New Jersey, it is time to select a priority health issue. Generally, an issue is determined based on 1, the magnitude of the issue, how many people are affected by the problem, 2, seriousness of the consequences, or what type of burden is placed on the community, and 3, feasibility of correction. Are there tools available to help correct the issue? For Trenton, New Jersey, the issue of the highest priority is obesity. Per a study from 2016, residents ranked obesity as one of the top 3 highest issues for public health concern, indicating that a desire and impetus for change does exist. Also, when reviewing the population, 39% of the total population is afflicted versus only 16.9% of Mercer County overall. Obesity is also twice as likely to occur in those with only a high school diploma in this region, which, as we learned, makes up a majority of residents. Additionally, 49% of children between the ages 3 to 5 are overweight or obese. And when further broken down in the table to the right, you can see that there is a higher rate among children who are of non-white races and ethnicities. And these races also make up a majority of the population, particularly Hispanic youths. Now, in order to correct this issue, several barriers will need to be addressed. Social barriers include the fact that most residents don't feel safe in their neighborhoods, which limits their ability to exercise outdoors and encourages a sedentary lifestyle. There are also limited healthy food options, since 80% of the food sources are either convenience stores or restaurants. For economic barriers, many residents cannot even afford healthier options, since over a third of residents are below the poverty line. Also, the Recreation Department of Trenton, New Jersey, has experienced some severe budget cuts recently, which limits the city's ability to provide quality activity options for residents. Finally, for political barriers, the looming threat of an ACA or Affordable Care Act repeal is a consistent concern among residents, since if coverage is lost, there will be even further reduced access to health services and health information that could be critical for prevention and maintenance. However, there are numerous community assets available to help address the problem. For instance, Trenton Health Team is a collaborative partnership that seeks to provide quality health care and education to residents regarding their health concerns. The New Jersey Partnership for Healthy Kids Trenton has improved access to healthy foods like produce by partnering with local stores. Also, the Trenton YMCA provides a safe site for physical activity for both adults and children. Finally, this determination for the priority health issue was further corroborated by Madeline Oliveris, who is a public health nurse with decades of experience working with the Trenton Department of Health and Human Services. She agreed that obesity is one of the highest priority issues for the area and one that can be addressed with using the community assets. Many of the vulnerable populations that she meets with daily have this very affliction. Furthermore, by addressing obesity as a concern head-on, she advised that it could lead to added benefits, like a reduction in diseases that result from obesity, like heart disease, cancer, and diabetes mellitus, which are all among the leading causes of death for Trenton in the last decade per the health profile. Finally, these are some of the references used for this presentation. Thank you so much and have a good night.